Good morning again. I got my bone scan results. DXA lumbar, spine, and hip. Bone densitometry was performed. Densitometry, I like that name. Okay, so we got World Health Organization criteria for BMD impression. Classify patients as normal. T-score at or above 1.0. Osteopenia, T-score between negative 1.5 and negative 2.5, and osteoporosis at or below 2.5. My spine is at negative 1.0, so that's normal. My femoral neck and my total hip, they're both at 0.7. That's a Z-score. The T-score is 0.881. Femoral neck is 0.713. And total hip is 0.813. My risk factors of 10-year risk, fracture risk, major osteoporotic fractures at 3.2%, hip fractures at 0.2%. It looks like the neck is a little, not great. It says, but the impression, the important stuff. The patient's bone mass is within expected range for age, gender, and ethnicity. The patient has an estimated 10-year risk of hip fracture at 0.2%. And, yeah. So, it appears as though I don't even have osteopenia. It appears that my bone, which, by the way, I'm really thankful of, because I was scared of it because I've been anemic and vitamin D deficient for so long that I was quite worried about this one. It's hard to tell because these scores don't make any sense. Normal, T-score at or above negative 1.0, okay? At or above. All of them are like that. Oh, no, wait, no, the T-score is the negative 1.0, negative 0.7, negative... You know how my chart is. It's a little wonky with the way... So the BMD is 0.881 and so on and so forth. So it looks like I have normal... maybe the neck is a little bit light, maybe, I don't know. But yeah, they're all below, at or above 1.0. They're not above negative 2.5, that's for sure. So... I don't know how else to interpret these results, so I'm gonna go on that I have normal bone mass in the impression until I hear different. I'll send these to my PCP probably within the next few days. I don't see him till April 11th, so I don't have to do it until then. But I'll probably do it before just to have it done, and he can maybe interpret some of this stuff a little better for me. I'm not gonna send it to my gastro because I'm not sure these things are necessarily relevant for her, other than whether or not I can undergo transplant, which looks like it's a yes. Looks like my body is perfectly able to withstand the stresses of a transplant, according to everything they've tested over the past month and a half. So yeah, there we are. I don't think there's going to be any more test results until I get some more blood drawn from somebody. Probably my PCP is going to want it, which, great. I feel like we should get my blood drawn once a month. Keep an eye on this liver. But we'll see what he says when I see him. Okay, well, there we are. I have to go back to work. I can't really talk about any more that happened. But if I think of something, I'll come back. But I think I pretty much covered everything of any import. So thank you for watching, and I will talk to you later.